All right. Okay, the next parasite that we are going to discuss, this is actually parasites kasi dalawa po ito. We have here your hookworms. No? Hookworms, again, is a general term for our Necator americanus and uh, Ancylostoma duodenale. Okay. Ngayon, even though that they are different parasite, even though that they have the different pathophysiology, the eggs of one another is similar. The eggs are indistinguishable to one another. Okay? So yun na lang yung panlubag loob doon, no? The eggs of hookworms are the same. Now, like what I've said, okay, there are two uh, species, actually four, okay, species of hookworms. Okay? Now, the egg of hookworm, kagaya po ng sinabi natin kanina, the egg of hookworm is general for both Ancylostoma duodenale and Necator americanus. Remember guys that the egg of a hookworm usually has the size of 60 to 75 or 55 to 60. For Necator, that is 60 to 75. Okay? For Necator is 60 to 75. For Ancylostoma is 55 to 60. However, other parameters are the same. That's why if you are not capable to measure the size of the egg, you cannot identify if that is Necator or if that is Ancylostoma. Take note, no, that the egg of hookworm consists of what we call embryonic cleavage. Sometimes it can be two, sometimes it can be four, or sometimes it can be eight embryonic cleavage. That's why it is one of the difference between the egg of hookworm and Strongyloides. Si hookworm kasi, meron siyang 2 to 8 embryonic cleavage. Okay? Remember guys that this parasite, that this worm, again, kilala siya sa pag-infect ng man. No? And the habitat of hookworm is the small intestine. Remember, like what I've said a while ago, ash. Ay, parang, o nga. I remember, Hymenolapis po ata yung sinabi ko kanina, that is hookworm. No, not Hymenolapis. I'm sorry, I forgot. Bigyan ko lang naalala. No? If I said a while ago na Hymenolapis, kindly correct that. It should be hookworm. Okay? That should be hookworm. Okay? So again, it resides in the small intestine. Now, we have here your Rhabditiform. Again, Rhabditiform is the early stage of, no? Rhabditiform is the early stage of larval stage for our nematodes. Usually 25, usually 270 by 15 micrometers and 540 to 700 micrometers long. Okay, the 5-day-old hatch Rhabditiform. If we are going to compare the Rhabditiform from Filariform, yung kanyang buccal cavity is long. Okay, long buccal cavity of our Rhabditiform and small genital perimordium. Now, our Filariform, yung esophagus niya, short. Yung kanyang tail, pointed. And take note, small or short ang kanyang Filariform. Ang kanyang, what you call this? Buccal cavity. Okay? Now, what is the difference between Rhabditiform and Filariform? Again, kapag sinabi nating Rhabditiform, that is the first stage, short, open mouth because of the long buccal cavity and the feeding stage. Filariform, on the other hand, is the second larval stage, long and slender, closed mouth, and non-feeding stage, and considered as the infective stage of the hookworm. Now, in terms of the adult, no, dito na natin ma-differentiate. Okay? We can now differentiate, no, the what you call this? The Necator americanus from your Ancylostoma duodenale. Paano? Sa anong paraan? Okay? And of course, in terms of how it looks, in terms of its buccal capsules. O later, I'm going to show to you paano natin ma-differentiate ang hookworm adults natin in terms of its buccal capsules. Meron tayo dyan palatandaan. Okay? So for the color, grayish pink to grayish white to pink, cuticle is somewhat thick, no, anterior end is conspicuous bend and hook. Kaya siya tinawag na hookworm. Okay? Kaya siya tinawag na hookworm, it is because of the anterior end, hook-like. Okay? Kaya siya nakakapag-attach din sa mucosa ng ating intestine. O, yun, nasagot na natin ang tanong. Bakit hookworm? Because of its anterior end. Okay. Now, in terms of size, definitely, female is larger than male. Female is larger than male. Now, the other features of our male and female is their copulatory bursa. The copulatory hindi bulsa, bursa of our hookworm is prominent pagdating sa male. Okay? So that's how we differentiate male and female hookworms. Ngayon, paano po yung Necator and Ancylostoma? Kasi yung color, yung cuticle, yung anterior end, yung size and features nila almost the same. They differ into its buccal cavity. Okay? Ano po yung merong sa buccal cavity? By the way, baka kasi malito kayo. Nakalagay dito, Ancylostoma duodenale adult female. May copulatory bursa siya. Bursa. Sabi mo, sir, prominent sa adults na male. Yes. Meron ng female, hindi siya nawawala nun. Pero prominent siya sa male na parasite. Okay. This is what I am telling a while ago. How are we going to differentiate Necator from Ancylostoma in terms of its buccal capsule? Bakit? Si Necator americanus, meron siyang two pairs of cutting plates. No? Pairs of cutting plates. Si Ancylostoma duodenale, meron siyang two pairs of teeth. No? Necator, cutting plates. Ancylostoma, teeth. Two pairs of teeth. Ayan. Necator americanus, meron siyang cutting plates. Si duodenale, meron siyang teeth. Necator americanus, meron siyang cutting plates. S shape. Cutting plates. Okay? Si Ancylostoma duodenale, meron siyang teeth. Teeth. Duodenale. Teeth. Letter C. No? Ancylostoma, may letter C. May teeth na letter C, si Ancylostoma duodenale. Si Necator americanus ay mayroong cutting plates na kapag tinrace natin, parang S-shape. Alright? That is how are we going to differentiate our parasite, our hookworm. Two pairs of teeth, Ancylostoma duodenale. Necator americanus, S-shaped cutting plates. Okay? Diagnosis is usually your stool. No? You can also use your Haradamori. Haradamori para kanino? Correct. Kay hookworm. At saka kay Strongyloides stercoralis. Okay? Now for the life cycle, ito medyo kakaiba yung ating initiation ng infection. Why? Because the initiation of infection started when the Filariform migrates or penetrates the skin. Take note that the mode of transmission of hookworm is skin penetration. Okay? The mode of transmission is skin penetration. Okay? Skin penetration. So the Filariform, which is the infective stage, penetrates the skin, usually on the lower area. Now, after that, the Filariform penetrates, therefore, it will initiate, it will mature. The larvae will mature into its adult, leading to the formation of Ancylostoma duodenale or Necator americanus, depende kung kaninong egg yun. Once na meron ng male and female, merong sexual reproduction. Okay? Now, there are cases no, that our hookworm penetrates or migrates. So, gaya nga sabi natin, siya ay member ng ASH. ASH, ASH, ASH. Heart lung migration. Heart lung migration. Okay? ASH, ASH, ASH. Sino yan? Ascaris, Strongyloides, hookworm. Si hookworm, member din siya ng ano, unholy tree. Ang hindi banal na tatlo. In Catholic faith, we have the Holy Trinity. In parasitology, we have unholy tree. Ascaris, Trichuris, hookworm. Hot. Hot, the unholy tree. Or, tawag natin sa kanila, the triad of infection. Yeah. The triad of infection. So, going back, no, capable siya ng heart-lung migration sa heart, sa lungs, kaya pwede siya mag-cause ng ano? Pneumonia. Pwede siya mag-cause ng ano? Problem in the heart. And take note, guys, that our hookworm is capable of causing what we called anemia. Mamaya, pag-usapan natin yan. Now, kapag po nalay na yung, or kapag nagkaroon na ng sexual reproduction, so magde-deposit ng egg, ang ating hookworm that can be shed in the stool. That's why stool can be, the egg can be seen in the stool of the human. Now remember, people of God, that no, an adult female or the adult gravid female can lay 10,000 to 20,000 eggs per day. Ganun kadami. Okay? 10,000 to 20,000 eggs per day ang nade-deposit ng gravid female hookworm. Now, like what I've said, no, Ancylostomiasis or Necatoriasis can cause allergic reactions. These allergic reactions is due to the site of penetration and usually referred as the ground itch. No? The site of penetration, mayroong intense itching that is an allergic reaction to the penetration ng ating hookworm, ng ating Filariform. At ang tawag doon, ground itch. Sore throat is possible because of the capability of our hookworms to migrate. Okay? Bloody sputum, sweating, headache, and mild pneumonia with cough. Now, mild infections, no? Mild infections can lead into what we call gastroenteritis or gastrointestinal symptoms. Slight anemia, weight loss, and weakness. Ba, bakit naman itong si Necator americanus ay nagkokos ng anemia? Ano ito? Akala ko ba diarrhea lang? Bakit si Necator americanus at si Ancylostoma duodenale ay nagkokos ng anemia? Take note guys, take note that our hookworms is a blood-sucking nematodes. These are blood-sucking nematodes. That's why they are capable of causing anemia. Ay nagkakameron ng blood loss ang ating pasyente. Okay? Now remember, in acute infections, ito naman, no? Greater than 5,000 eggs per day, 5,000 eggs per gram of feces. Paano natin yung malalaman? Through quantitative test, meron pong ginagamit ang WHO. If you still remember in our discussion, meron pong ginagamit ang WHO na criteria para malaman if that's an acute or mild infection. Now, in acute infection, no, there is what we call diarrhea. Well, of course, anorexia, edema, pain, enteritis, and epigastric discomfort. And the anemia associated to Necator americanus is what we call microcytic hypochromic anemia. Take note ha, microcytic hypochromic anemia. Microcytic hypochromic anemia. Okay? Iron deficiency anemia is also possible in Necator and Ancylostoma duodenale. Weakness and hypoproteinemia. Possible mortality because of the blood loss. Okay? So for the treatment, again, we have your mebendazole or iron replacement, which is effective against asymptomatic patients. Okay? Similar in control is usually the same thing as to your other parasites. And lastly, covering bare feet. Okay? Para hindi makapag-penetrate ang mga filariform. Now, CLM is what we call cutaneous larval migrans. Okay, yung mga cutaneous tissues natin. These are also caused by hookworms. At sinong hookworms po yan? Si Ancylostoma braziliense, which is known to be your cat hookworm, and your Ancylostoma caninum, which is known to be your dog hookworm. Originally, these are their host, dogs and cats. Kaya mag-ingat kung may mga alagang hayop. Okay? Cutaneous larval migrans. Kung makikita nyo dito sa illustration natin, from the CDC, yan. Ganan. Akala mo ay varicose veins lang, pero parasite na pala yan. Pero ayan pala ay larval migration na ng parasite. Okay? So ganun ang itsura ng cutaneous larval migrants during the skin penetration of the parasite. So please be take care if you are fond of dogs and cats. Okay? Again, Ancylostoma braziliensis cat. Ancylostoma caninum dog. Ako yung may palatandaan dito na lagi kong itinuturo sa aking mga estudyante. A, B, C. Ancylostoma braziliense cat hookworm. ABC, Ancylostoma braziliense cat. A, C, D. Okay? Ancylostoma caninum dog. Kung gusto mo, para kumpleto, A, B, C, D. Okay? Yung C, naging B. Ganun kayo eh. Di ba? Pag nag-exam, kapag no erasure, gagawa ng paraan na yung C maging B or maging A. Okay? ABC, Ancylostoma braziliense cat. A, C, D, Ancylostoma caninum dog. Hookworm. Take note, guys, that these hookworms are capable of what we call cutaneous larval migrants. Moving forward to our next parasite, Strongyloides stercoralis. Strongyloides stercoralis, like what I've said, no, meron siyang embryonic cleavage through with the embryonic cleavage of our hookworm. Okay? Sometimes 2, sometimes 4, sometimes 8 cell stage are present. Meron siyang thin shell and hyaline. Almost similar to the egg of hookworm. Okay? Usually or typically, no, the egg of Strongyloides stercoralis contains well-developed larvae. So again, how are we going to differentiate the the Strongyloides stercoralis? Ito yung mahalagang tandaan dito. Yung ating larval stage, lagi ko natatandaan, yung teacher na ito, kapag Strongyloides stercoralis, meron siyang tinatawag na alpha nut tail. Alpha nut end. Alpha nut tail. Okay? Ito po yan. No? Skin in the Filariform of our Strongyloides stercoralis. Alpha nut tail. Kapag narinig nyo si alpha nut or nut tail, alpha nut tail. Bakit alpha? Parang alpha. Okay? That is your Strongyloides stercoralis. So this is the difference between the Filariform and Rhabditiform of our Strongyloides stercoralis. Now, how about for the difference of the Strongyloides stercoralis Filariform? Oh, no. The difference of hookworm and threadworm larval stage. Ayan. Mahalaga yan. No? Mahalagang i-differentiate natin yung threadworm at saka si hookworm. Sino ka ang threadworm? Threadworm is the Strongyloides. Hookworm, edi si hookworm. Okay? So how are we going to differentiate that? In terms of buccal cavity, long ang buccal cavity ni hookworm compared to threadworm. In terms of genital pyremordium, small ang kay hookworm, prominent ang kay threadworm. Sheeted tail, pointed kay hookworm, not kay threadworm. Kaya nga alpha nut, parang naka-ali. Okay? Ang tail ni threadworm. Okay, now for the adult, now this is the adult Strongyloides stercoralis, colorless, transparent body, finely striated cuticle, short buccal cavity, long and slender esophagus. Okay. So for diagnostic test, we are going to use eggs, no? Demonstration of the eggs. Or sometimes, usually kasi, pag Strongyloides, mas nakikita yung kanyang Filariform. Okay? Mas nakikita yung Filariform. Even the Rhabditiform. No? Yung, or in other words, the larval stage. No? Mas nakikita yung larval stage ng Strongyloides stercoralis. Even in the stool, nakikita siya doon. Okay? Remember, zinc sulfate concentration test is also good concentration technique for the recovery of the egg. Entero test is also possible. Kagaya nino? Kagaya ni Georgia Lambia. Di ba entero test or string test? Yung mayroong capsule and string hihigitin after the incubation para makaware o ng duodenal content. Okay? Serological test is also possible. Now, for the life cycle of our Strongyloides stercoralis. Now, take note, guys, dog serves as the definitive host. Okay? Like your Enterobius vermicularis, take note, people of God, that Strongyloides stercoralis is also possible or also capable of causing auto-infection. Okay? So, paano po tayo nagkakameron ng infection? Remember that the life cycle of Strongyloides stercoralis can be free-living. Kagaya nga na sinabi natin, pwede silang walang host. Okay? Now, ano yung nangyayari? Paano po tayo nagkakameron ng infection? Take note, guys, that the introduction or the initiation of the infection started when the infective stage, Filariform, initiates your, what you call this? Initiates skin penetration. Almost similar sa life cycle ni hookworm, nag-i-skin penetration. Okay. Once that the Filariform of your Strongyloides stercoralis or the threadworm penetrates the skin, ano yung mangyayari? It will migrate into various pathways of the body, leading to the small intestine where it matures into adult form, cash, small intestine. Now, what will happen? Okay, this adult Strongyloides stercoralis, therefore, meron na siyang male, meron na siyang female. No? Ano yung mangyayari? Yung female, maglelay ng egg. Now, that will be deposited into the stool. Okay? That will be deposited into the stool. Siyempre, itong egg na to, no, deposited in the intestinal mucosa, the egg will rapidly mature into Rhabditiform larvae. Kaya nga usually, yung mga larval stages ng parasite natin, ng Strongyloides, yun yung madalas nakikita as compared to the egg. Okay? So, the Rhabditiform that is excreted by the body or the stool that contains the egg, yung egg magmamature rapidly into Rhabditiform. Yung Rhabditiform in the external environment, sa labas ng katawan ng tao, free living na siya doon eh. Wala na yung tao. Wala na yung tao sa part ng buhay niya. Pwede na siyang mag-mature. Okay? That will transform, pwede siyang mag-transform, no? Going to Filariform that will initiate another infection. Or this Rhabditiform naging Filariform, kung Filariform naging adult outside the body of the host, nagkameron ng male and female, no, nag-union sila, nakapag-produce ng egg. Okay? Yung egg, again, naging Rhabditiform hanggang sa naging Filariform na nag-initiates ulit ng another infection. Now, there are three ways. Number one, direct. Mimics the life cycle of hookworm. Okay? Mimics the life cycle of the hookworm. Paano? Through skin penetration, maturation in the small intestine, union of male and female, nag-produce ng egg. Okay, yun nga lang, yung egg usually na papas agad. Or kaya man sa nagiging rhabditiform agad siya. Kaya yun yung madalas nating nakikita, the rhabditiform or the larvae form. Eggs are occasionally found in such samples. Hindi madalas. Madalas yung rhabditiform. Madalas yung larvae form. Si Filariform pwede din naman. Pero between Filariform and Rhabditiform, mas common si Rhabditiform. Now, indirect. Indirect life cycle includes that Rhabditiform larvae are passed in the outside environment and mature into free-living adults that are non-parasitic. Kagaya yung itong part na yan. Ito yung indirect sa labas ng tao. Okay? Or auto-reinfection. The rhabditiform larvae develop inside the human intestine. Yung egg, hindi mo agad natapas. Kaya nagkameron ng rhabditiform. Yung rhabditiform naging filariform, yung filariform naging adult, magdagan yung adult, nagkameron ng another infection. Take note guys, no, that this infection is also capable of entering the lymphatics, the bloodstream, no, that initiates the new life cycle. Anemia, since it enters the bloodstream, is also possible. Now remember guys, these are the clinical conditions associated to Strongyloides stercoralis. Diarrhea, abdominal pain, urticaria with eosinophilia, vomiting, constipation, variable anemia, pulmonary symptoms during parasite migration. Possible. Possible po bang mag-migrate ang ating Strongyloides? Oo. Ash nga, di ba? Heart lung migration. Pwede. Okay? Now, what do we mean by urticaria? When we said urticaria, it is also known as hives. Okay? It is also known as hives. It is a infection, no? A swollen, pale, red bumps or plaques on the skin. Okay? It is either because of the allergic reaction of the host to the parasite or sometimes pero usually because of the reaction to the parasite. Okay? So the treatment includes ivermectin. Ayan. Dito si ivermectin hindi kay COVID, no? Ivermectin or albendazole. Ivermectin sa dog, sa mga hayop. Kasi ngayon dog serves as the definitive host, hindi sa tao. Okay? Hindi sa tao pwede pero hindi pang COVID, pang bulate. Okay? Usually kasi yung ivermectin ay ano nga yung tawag doon? Formulated as antiparasitic infection for animals. Okay? Now, prevention and control, exercising proper sanitation and proper hygiene. Okay? And then covering the bare feet and skin from contaminated soil. Mahalaga yan. Okay? Since strongyloides is also the means of or the mode of transmission for strongyloides is also skin penetration. Therefore, appropriate foot attire is possible.